Hi everyone, come on in. Today it's all about histamine intolerance, and we have Dr. Costa joining us to basically teach us everything we need to know about histamine intolerance. So I am really excited. I hope you are too. It's a chance for you to ask questions. Hi Elisa. We're just about to start. I think Dr. Costa is live now or joining us now. So go live with Dr. Here we go. I think he should be joining us now. And he's just, hi Dr. Costa.
Hello.
Good evening.
Hi, Nishti, how are you?
Good. How are you?
Hands cold, but okay.
Oh, cold. Oh, you have a cup of tea.
Oh yeah, I'm warming up my hands.
Well, they say I used to struggle with cold hands and feet, and I went to the GP as a teenager, and he said, "Well, cold hands and cold feet means warm heart." And I remember thinking, "Really, is that it?"
Yeah. I believe that.
So I'm so pleased you're here today
Thank you.
because we always get so much value, and obviously the focus is on histamine intolerance, but I'm sure people will have allergy related questions. So, and I think you're open to answer any questions.
Of course, because they are, the histamine intolerance and some other things that we need to know are interconnected with allergies, with food allergies inclusively. So yeah, of course I am. I'm
Lo-
not happy to answer anything at all.
Lovely, lovely. So, I was thinking, should I write down some questions? But I think we just go with the flow.
Yeah.
And if someone is watching this and they've heard about histamine intolerance and they're thinking, oh, I think I might have some of the symptoms. Where do we start with this whole concept of histamine intolerance? What's the first thing people need to know?
Well, the first thing is, like a lot of other things, histamine intolerance and people saying that they suffer from histamine intolerance, I think it comes in waves, and it's like sometimes it's almost fashionable to have this disease or that disease or a syndrome or whatever. So, but the main thing to know is that histamine intolerance is actually, as many other things, quite rare. Now, the big problem about histamine intolerance is not only how can we diagnose it, and that is a big how, because
Yes.
there's a consensus about what should we do if we suspect histamine intolerance, and we should go with that one. How do we do it? Should we just assume it? Should we make an association straight away? Actually, there's a long protocol in which it ends by something that most hospitals in the country don't do, which is a double-blind placebo-controlled challenge to see if in reality that person is really histamine intolerant or not. And this, despite the fact that sometimes you can do some tests, and there are tests that we're going to talk in the meanwhile, to see if someone is really histamine intolerant. But if the tests are negative, how are we going to prove that that person still is? So a double-blind placebo-controlled trial is the ultimate test, but as I said, rarely it is done.
Yeah, I can't see that happening in the NHS. That's a lot of it's not practical, is it?
No, it is not, because let's start with the other big problem, which is studies have suggested, let's start with the most important one. There's a lot of food that contains histamine. And tomatoes is probably one of the ones that have the highest one. And we are not even going to go yet to meat, but meat, being fish or meat, also has a lot of histamine, depending on if it is new, old, cured, not cured, so smoked. But what happens is, with all this, not all the foods that contain histamine in reality should be excluded for someone with histamine intolerance. Evidence says that it is probably around 32%, 32, that should be excluded. So this means that 68% of the foods that contain histamine should never be excluded. And that is why doing just a blind exclusion of histamine in food, it's wrong. It's utterly wrong and actually leads to significant nutritional deficiencies.
Yes, I once had a client who was put on a completely low histamine diet by a nutritional therapist, and it was so limited. It was scary. And can I just say that I tried to follow the low histamine diet myself just to sort of learn about it, and it is very hard, especially if you love tomatoes. You know, I love everything has tomatoes in it, and so it's very difficult, very difficult.
Now
So
imagine for someone like me that loves smoked, chorizo, hams, and all that. Now,
yes, yes, extremely difficult.
my life would be a very, very, very sad one without my cheeses and all those things. No, and
Oh,
those are
love,
things that
love.
contain a lot of it,
Yes.
a lot of history.
So what is for anyone watching? What is histamine? It,
So histamine is actually a chemical that we produce that is actually very important. So, and the main importance of histamine for us is it acts as a neurotransmitter. So the brain cells. So this is probably the important part. We're talking about the other one that people are more worried about. But so the nerve cells, for them to conduce electricity from one nerve cell to the other, one of the mediators that are used is histamine. And that is why that sometimes when there's too much histamine around the brain, some people can have signs of being, fogged thoughts, dizzy spells, headaches, and so on and so forth. So, and that's why we sometimes try to control the amount of histamine going into the brain, but sometimes controlling it too much is quite unhelpful. But then we also produce histamine in relation mainly to allergic reactions or in stressful situations. Or then there's a few other rare syndromes that can lead to an increased release of histamine without us knowing what it is. And things like spontaneous urticaria, spontaneous edema are mediated by histamine among other chemical mediators. So histamine plays a role in a lot of things. It even plays a role in digestion. So as you can see, from the gut to the brain, it goes everywhere and can affect every single organ. So this is the importance of histamine in our body. And therefore, not only we produce histamine, but we also produce a way to control the histamine that we produce or the histamine that comes from outside, so what we call exogenous sources. So that is the part that people need to understand how and when and why does it affect.
okay, and so if someone, because you've done a lovely post where you explain the symptoms of histamine intolerance, can you go through those again if that's okay? And then, because very
It varies
difficult.
so significantly because when you look at it, I put an image on my post about which organs does it affect. Now, the important thing about knowing about histamine intolerance is that the way that it affects one organ sometimes can be slightly different from one person to the other. So imagine that it can affect the bowels. So the most common sign that people are going to feel is, diarrhea or loose stool, but not always. Some people will complain of abdominal pain that sometimes can be associated with extra gastric bowel contraction. And that sometimes can also be as a side effect from extra gas being produced. And that is when it comes into that gray, shady area about, so is it really histamine being the cause for these symptoms, or is it some other thing that now we call so many times intolerances, though histamine itself can be called an histamine intolerance when we have low doses. So it varies a lot. So if people look at the map that I've shown, so it can affect the skin, can affect the heart, can affect the lungs, can affect the kidneys, can affect the brain, so on and so forth. It will affect everywhere. So, for instance, liver-wise, you can have mild jaundice associated with an histamine intolerance, for instance. But people complaining of liver pain, no, that doesn't exist. Liver pain is ultimate and it is associated with quite nasty end-of-life diseases.
So when you have a patient that comes in with, let's say, tummy pain. Would you ever think histamine, or would you rule out everything first and then lastly think histamine intolerance?
Well, I think that the first thing that I do with any of my patients is to take a very accurate history. Without having a proper history about what are your symptoms, when do they happen, is there an association or is there a delay between something that you have done, especially ingestion of any food in particular, and the onset of the symptoms? We need to look into that one. So one of the things that we need to look into is sometimes milder forms of allergy. So doing simple things, the skin prick test, sometimes can rule out an allergy and not a problem with histamine intolerance. So, and those are the things that we need to look into. Because though people think, when it comes to allergies, normally people tend to think about the extreme straight away. The breathing problems, the swellings, the vomitings, anaphylaxis. No, not always it's that. You have a lot of people that their signs of allergic diseases or allergic reactions is simply on their stomach.
Mm-hmm.
So, if you are in question that is that association, and especially if it is a very fast association between ingestion and the symptoms, you need to think about, okay, is it an allergic reaction or is it a gastric problem? Because sometimes can be a gastric problem without any association with the food itself. Because, a lot of people can have inflammation of the stomach called gastritis, and especially nowadays with so many stressful situations is one of the main causes for gastritis. People can have gastric ulcers. All of them can lead to these type of symptoms. So try to look at the most obvious conditions that lead to those symptoms before we go into the ones that are less common. So what is common is common. What is not common is not. So let's go for the common ones first.
Okay, and I guess when you've done your clinical history, and if someone has struggling with diarrhea and then perhaps they got lip swelling once in a while, is that when you will then think, oh, there might be something about histamine here?
It can be. And then we think about, let's start to think about if there's an association. And if there's an association with foods, then, we need to think about exclusion of foods to see if there's an improvement of those symptoms. Because some people might have reactions just to a certain type of foods, just to a certain ones that have higher contents of histamine and not others, for one reason or another. So that can happen. So, and again, in this stage, when I always look help from a dietitian, because I need guidance to those parents or that patient about what should they exclude that fit into the same group of foods, and also how can they complement what they're taking so they don't get into a nutritional deficiency. So those two must complement each other. So, and then afterwards, I need to think about what investigations am I going to do. Okay. And the main one, the first line for check for histamine intolerance is a urine test. Is a 24-hour collection of something called methylhistamine. So it's not a blood test. A lot of people come to me and asking for a blood test for histamine. No point in doing it, because histamine has what we call a half-life of 15 minutes. So even for someone that has an allergic reaction, if I'm going to test to see if that person has a raised histamine, I'm not going to test it. Unless if it is, I'm lucky enough to take the blood 15 minutes after the reaction, then I'm not going to be able to do it. It degrades very, very fast. Histamine degrades very fast. But as it degrades, it makes a component called methylhistamine, and that is stable and is excreted in the urine. So you can find out if you are producing too much histamine or not, or if you are intaking too much histamine or not. So it's one of the ways to do it, is that.
Right. So if someone comes in and you do skin prick tests in your clinics, let's say they're all negative, but they still have all these symptoms, is that when you will do the 24-hour urine test?
Yes, if I see that as an indication, an association, and we're considering that, especially as I said, with the swellings here and there and a bit of diarrhea here and there, we need to consider if there's an involvement of something else. And also you need to consider, because there's a lot of autoimmune conditions that can lead to the same type of symptoms. So when I ask for urine for methylhistamine, there's a lot of other things I investigate at the same time. Those are blood tests. But for methylhistamine, urine. Eventually, if there's the possibility of being one of the, let's say, antihistamines that we produce, and then I request a blood test. And that is the thing that we will talk in the meanwhile about the antihistamines that we naturally produce.
Right, right. This is very interesting. I'm sure you see a lot of patients who've been struggling for years and they haven't had an answer to why they feel the way they do, and then
No, but
histamine.
what is interesting as well is that from all of the patients that I had so far that I've run those tests, I have 2 with something called a diamine oxidase deficiency, 2.
Okay.
And I have, on those same 2, the ones that have raised methylhistamine. So if you see, I've seen thousands of patients so far, and I only have 2 with that.
That actually lack the enzyme that breaks down histamine.
Yeah. So that is it. So let's go to that one. Let's take the chance.
Yeah.
So for people to know that we produce 2 antihistamines ourselves. One is DAO, also diamine oxidase, and the other one is called HNMT. So more complicated name, histamine N-methyltransferase. So it's an enzyme as well. Now, how do they work? HNMT, which is very, very difficult to test, and actually in the country, as far as I know, there's no one doing the test. HNMT only exists inside the cells. So any histamine that goes inside cells that we are circulating in our body, HNMT will control it and will try to degrade it. So that's where it has the main effect. So, and then we have something called diamine oxidase. So DAO is more widespread produced, and it is produced mainly to the bowel to deal with histamine straight away as you're eating something with a high histamine content. The AL will deal with it straight away, but it also is produced to the bloodstream. So any histamine that stays outside of the cells, the AL will deal with it. And that is why some people call it also histaminase. So anyway, so we have those 2. DAO we can test. There's only 1 or 2 labs in the country that test for DAO. HNMT, there are tests for it, but no one is doing it. Most of the tests that have been done to quantify HNMT is more as a matter of research. So we know how to do it. It's a matter of research, but because it's so rare, there's no point in doing it because it would be extremely expensive. I know that in the United States, there's a couple of labs, I don't know how many, that will test for HNMT, but not a lot.
Okay. So, wow, that's a lot of info. Anyone online that has any questions, please let us know, because with histamine intolerance, I mean, the reason why I asked you to join is because there's been more clients coming through with histamine intolerance and more people are talking about it. And I think it's because of long COVID, there being a link with long COVID. What's your take on that?
The evidence says that there is no connection between long COVID and low with histamine intolerance. So current advice is that do not do a low histamine diet for someone that has a long COVID. So there's no relationship between one and the other. Okay, and also another thing that it's interesting to understand. So we know that, and we come back to foods and the foods that have higher contents of histamine. There's also people talking about foods that will induce the production or release of histamine from other organs. Okay, we know that they exist, but actually no one knows what is the mechanism for that. So we don't know if truly the impact of those, what we call amine releasing substances, are really truly effective or not. They exist, yes, they do. Are they really making an impact to make things worse? No one knows. So investigation is still going on, but no one really knows. So that is why when they talk about the low histamine diet, normally they leave out those foods that potentially can lead to the release of histamine, because again, that's not proven. And it's interesting that a while ago I was speaking to Roseanne, and for some people that don't know who Roseanne is, from there's two, probably without insult to anyone, probably the two most knowledgeable dietitians in the country. Roseanne Barr is one of them, and Isabel Skipala is the other one. But they are, I've worked with both of them, and currently I work still with one of them on the guidelines of the BSACI. And when I was talking to Roseanne a while ago, she was mentioning exactly that. There is really no evidence to support doing an extensive histamine diet, and it needs to be on a one-to-one basis. Because one of the things that she mentioned, and this is reported as well, is how much is there the psychological or placebo effect? Okay, by doing this. There is. I guess that there is. How many? I have no idea, but there is a link between the two.
Right, because there are the cause of a histamine intolerance are also, there are many causes. Is that something you could explain? Because I think that plays a big role to understanding as well.
It is also connected with certain diseases. So we know that things like Crohn's disease sometimes is associated with histamine intolerance. A lot of those conditions that lead to what we think it is histamine intolerance are probably more or less the same, the ones that lead to transient lactose intolerance. So anything that can affect the bowel, that lead to an inflammation of the bowel, can potentially lead to an histamine intolerance. And then again, let's go to the overlap. Let's go to the gray area. Which one is which? Because if you have an inflammation of the bowel, so many things are not processed. So many things are not absorbed appropriately. So, and then from all of that we eat, and then suddenly just think that it is one of them that contains histamine that is causing the problems, I think it is probably narrowing it too much to be the reality. So likely is, if we're going to do an exclusion diet when there's this transient inflammation of the bowels, probably we would need to exclude so many things so the bowel could recover faster. Of course, lactose, anything at all that contains lactose is one that is advisable, but now is coming the trend of telling people, oh, exclude histamine as well, or histamine foods, because you're going to see an improvement.
Yes. There's a lot out there. It's become a bit of a trend, I think.
It is.
Careful, because it's a very restricted diet.
It is. I have a lot of people that come to me saying, oh, I've decreased the histamine intake and my headaches have gone away. Okay. So sometimes I ask them, so what have you replaced it with? And interestingly, sometimes the food that they replace it with is other ones that also contain histamine. So, so it is, as I said, we need to be very careful. We need to be very careful. And that is why if we have managed to do the double-blind placebo-controlled trials, we will probably know much more than what we do.
Yes, yes. So the factors that cause high histamine, obviously there is the lack of enzyme, but you've already said that you've only seen 2 people that actually lack the enzyme. So other factors you mentioned could also be, for example, Crohn's disease, anything affecting the gut. So dysbiosis in the gut. But
dysbiosis of the gut, yes, but you need to think about autoimmune conditions, because then it's not a matter of creating an intolerance because the histamine is not processed. It's actually because you're producing too much histamine. Okay, so sometimes what people call histamine intolerance, actually it's not. It's excessive production of histamine.
This is very important. I'm all ears. I need to hear this. I hope everyone's listening in.
So because we have, and we spoke. I just spoke about the spontaneous urticaria and spontaneous angioedema.
Can you
So,
explain what that is, just in case someone doesn't know what that is?
urticaria is rashes, hives. Angioedema is swelling. Spontaneous, well, the name says it all. Spontaneous. Sometimes we call it chronic spontaneous urticaria and chronic spontaneous angioedema. Also CSU and CSA. And no, it's not an American series about police and violence. It's and when the symptoms are there for over 8 weeks, it begins to be chronic. Okay, so CSU, CSA. Now there is a massive range over nearly 30 conditions that can lead to CSU, CSA. Okay, and one of them that is starting to be very, very popular is called mast cell activation syndrome. So I see loads of patients with potential mast cell activation syndrome, and honestly, most of them have not. It's not very common. I have a handful, or a bit more than a handful now, because I see so many of them with MCAS. So, and basically, what happens in MCAS and it happens in other autoimmune disorders is that the cell that produces histamine mainly is called mast cell. Mast cell produces a massive amount of mediators, and the mast cell is extremely important for the immune system. It fights fungal infections, bacterial infections, viral infections. So it is extremely important. It's probably the biggest line of defense that we have. Anything that leads to deregulation of the mast cell, and the deregulation leads to something that we call degranulation. We have really odd names for things. So the cells have something inside called granules. Granules are like small pouches, and each pouch has one type only of a chemical. So mast cells have hundreds, sometimes thousands of pouches with small mediators. Okay, so anything that leads to that degranulation, so it means that the release of the content of those small pouches into the outside, will lead to a reaction. And this is what happens, for instance, on an allergic reaction. On an allergic reaction, what a mast cell is, it releases their components, creating inflammation, and the inflammation that they create and all that is to try and protect the organ against something that is coming from the outside to attack it. So it actually is a protective mechanism. Sorry. The problem is, if it deregulates, it will release their components out, sometimes without us knowing why. And in mast cell activation syndrome, and sometimes in spontaneous urticaria and spontaneous angioedema, that's what happens. So therefore, with this, there's a certain increase and a massive increase of histamine circulating, for which the amount of HNNT and the amount of DAO that we produce cannot deal with. It's too much.
Okay.
Okay. And the other thing is, it is a sustained release. So one thing is released everything at all, and then within 15 minutes we feel better again because histamine degraded. But it's not. It keeps on releasing until it's like the factory runs dry. And when the factory runs dry is when it starts having the effect. Okay. But some people can have this factory running and producing more and more granules for quite a long time. So you can have an ongoing onset of symptoms for quite a long time. So this is another condition that leads to the problems that we're talking about, that often is mistaken for histamine intolerance, but in reality is too much histamine production.
So if someone has issues with a sudden swollen lip, and they are struggling with, and they know that high histamine foods are a trigger, how do you differentiate between high histamine or histamine intolerance and MCAS? How do you differentiate between those two? Or is that
that is a big can of worms, because MCAS is not the first thing that I would investigate. Never. Okay. Because it depends on the frequency of symptoms, how severe the symptoms are, and that will guide me on the list of investigations that I'm going to go. Actually, one very, very common that leads to that is associated with people that have dogs.
Okay.
Interestingly. So dogs have a specific parasite called Toxocara canis that when it is transmitted to the human being, can lead to these symptoms, can lead to the increased release of histamine.
Oh,
That
really?
is one of them. The other one, we spoke about stomach problems and gastritis. There's another bacteria that lives in a lot of people without causing symptoms, but sometimes it does, called H. pylori. So it lives on the stomach, and H. pylori, the name comes from the connection that is between the stomach and the small bowel, is called a pylorus. So it's a muscle that contracts. Is always contracted and then opens when the stomach needs to empty into the small bowel. And around there, there's a bacteria called H. pylori, and H. pylori can also lead to all these symptoms. So these two have
Right.
treatment, have an easy treatment. Another one, and actually I have loads of patients with it, is thyroid problems. So we produce sometimes antibodies against our thyroid, called TPOs, and this TPO, when reproducing it in a significant amount, can also lead to all these kind of problems. I have quite a lot of patients with that. So you see, these are common things.
Yes.
So while the parasite and H. pylori, there's a treatment for thyroid antibodies, there's no treatment. Unfortunately, we need to wait until the thyroid antibodies kill the thyroid, and then they'll stop being produced. But that people will need what we call levothyroxine to compensate the thyroxine that we do not produce, so T3 and T4.
That's
So as you can see, there's quite a lot of things, and
so
then there's
much.
a few more sinister ones that no point in mentioning them now, that can also lead to things like that.
Right. Wow. Your job sounds very complicated. There's so many
It's
factors
interesting.
you have to consider. Um,
Mm.
so it's one
Well,
problem.
I'll tell you one other thing, interestingly, for boys and girls, puberty leads to this
Okay. So
because
people present with histamine intolerance.
it can present with symptoms similar to histamine intolerance, but in reality it's not. It's about hormonal deregulation. And
Okay.
hormonal deregulation leads to excessive release sometimes, not always, bear in mind, not always,
Yeah.
in a very small percentage of teenagers, leads to excessive production of histamine, leading to swellings and hives and all those kind of things. And again, people come to me thinking that they are having some kind of histamine intolerance, and it's not. It's hormonal deregulation. So again, that one, we wait.
Wow. Okay. There is a question for you, Dr.
Mhm.
Costa. So Megana says, "Hi there. Have you known any links between non-celiac gluten sensitivity and histamine intolerance?"
Um, I won't say links between the two, because a proper link there's not. I know that there's a link. For instance, when I talk about autoimmune disorders, I always investigate for celiac disease, because celiac disease can lead to these symptoms as well. So especially the undiagnosed, or the people that have celiac disease but decide to keep on having gluten, they can have all these symptoms. Now, non-celiac gluten intolerance lead to symptoms that sometimes can mimic them, because non-celiac gluten intolerance is known to have either diarrhea, mainly diarrhea, and a bit of bloating. Sometimes can lead to a lot of itching because there's flare-ups of eczema. So, and again, people will think that they're having a histamine problem. Now, let's put something else into context that probably is not going to confuse, is going to clarify things, is that it is known that stress or stress-related disorders can lead to mast cells degranulating, so releasing histamine. So people that have a non-celiac gluten intolerance, that are stressed because of what they're going to eat or what they're not going to eat, or if they've eaten something that they think that's going to affect them, just the stress
Yes.
can lead to histamine release, can lead to symptoms.
Yeah.
So it's that area that we need to see. So is this really an histamine intolerance or not, or is it stress related? And as I said, stress nowadays affects people in so many different ways, including this one.
Yes. I stress a lot with patients because we provide holistic care, so we do it
Mm-hmm.
mindfulness as well, and it's amazing how when we manage to stress how much things actually improve. So it's not always diet related, is it? It's the whole being. It's our whole being that needs to be
You
looked
know, one of the big problems, Nishti, is that people tend to deny the existence of stress.
Yeah.
And stress exists. And I remember an interesting chat that I had a while ago with the mother of one of my patients, because it's a little one, now he's a big one, that I diagnosed with MCAS. And once I spoken to her and said, look, I think that probably you and him should be seen by a psychologist, because there are signs of PTSD, which a lot of people present with, post-traumatic stress disorder. And she was very honest with me, and she said, look, if it wasn't you telling me this, because she was a bit in denial about that. And then she said, look, if it wasn't you telling me about this, I would completely deny it, and I would feel that this was an offense to me and all that.
Oh.
And then as soon as she started seeing a psychologist, she started thinking that in reality, there was that component there. And how many of the symptoms that the child was having, because he was so stressed, it was unbelievable, that sometimes he was having what we thought were symptoms, but in reality they were not.
Mm-hmm.
So stress is very important to this. Stress can lead to histamine release. Stress can lead to things that we consider being histamine intolerance, but it is not. Again, it's a difference between the histamine intolerance and excessive histamine production. So in one way or another, what's going to happen is there's going to be too much histamine circulating, and that is the bottom line. But there are several ways to have too much histamine circulating.
I think stress management, personally, I think, of course, the dietary part is super important. And tomorrow we are actually going to talk a lot more about that with a dietitian, about all the food stuff. But I just think, I know it comes from a dietitian, but I think stress, to me, sounds like the most important thing. Because I find that, especially working even with adults that struggle with their gut, they want to find something, they want to find a food that's the trigger. And yes, often there is a food that's the trigger, but most often they are so stressed about the foods and everything, they want to control everything, that actually they forget to come back to here and now and manage,
You know what I think, Nishti, is that is probably a problem of the human being. We tend to try and find the culprit, the guilty part of what is happening to us outside of us.
Yes, this is
And
it.
and it is very rare that we accept that sometimes we are part of the problem.
Mm-hmm. I know.
And that means also, and that is the positive side, if we are part of the problem, we are definitely part of the solution.
Definitely. Yeah, we can look at it very positively like that.
And that is why so many of my patients, for other things that they have, sometimes they ask me, oh, what should I do? And I said, do meditation, do relaxation techniques, do yoga, something that keeps your mind away from it. Because, for instance, there's another condition called vocal cord dysplasia, in which people have symptoms like if they are being asthmatic, but in reality is they are so stressed, they control the vocal cords and they cannot breathe. And one of the things that is the best for them, along with breathing exercises, is yoga. So mindfulness, it's being aware of, because that's the difficult part is of this that is happening to me, what part is me, what part is outside of me. And even if we accept that 5 or 10% is me, it's a win already. I'm happy with that, because it's a start. Of course, we then need to find out, major component often is something else and not us, but there is always a component that is us. And that is simply, we are human beings and we are afraid. Simple as that.
Yes, yes. That's lovely. So if anyone has questions, please let us know. I just want to say, so we have covered what is histamine, the causes of histamine intolerance, the management. Management, obviously the dietitian is very important for that. But there's also, how about the DAO supplements? What's your take on that?
Okay. None. There's no take on that, because there's no research and evidence saying what is the dose appropriate.
Okay.
Okay, and that is the big problem. So if you're going to see, I've read a while ago when I did that post on the histamine intolerance, I read loads of research, and there is no consensus whatsoever. What is the dose that should be given of thiamine oxidase? And because of that, if you try and get a prescription for thiamine oxidase, it's not going to be issued. So you buy it on parapharmacies, online, or whatever it is. There is no proper dose about what should be done or not. Because also what we know is when there is a thiamine oxidase deficiency, the diamine is not like in other conditions. Thiamine oxidase deficiency means that you have nothing being produced. It's not like that. Okay, we are always going to produce thiamine oxidase.
Okay.
Now, what we don't know, and it's probably going to be, and that is the part that is hard to quantify, is so okay, we produce this amount, and this should be the supplementation, and that is what we don't know yet. Okay, and the other thing that we don't know yet is, are there going to be variations of thiamine oxidase production? Because, and the reason why I'm saying this is, we know that certain types of foods actually, and medication as well, actually stimulate thiamine oxidase production. Okay, so for instance, there's a couple of medications that we use for our stomach that sometimes I use for some of my patients with spontaneous urticaria and angioedema. There are some medications that will stimulate the production of thiamine oxidase. There's others, including antihistamines, interestingly, can suppress the production of thiamine oxidase. Okay, but because we don't know to what extent does it produce or restrict production or increases production, that's why we never tell someone, oh, stop taking that and take the other one, because sometimes there's also benefits from taking medication. Now, one of the things that I give loads of my patients with spontaneous urticaria and angioedema is vitamin C. Vitamin C not only naturally helps the degradation of histamine, stimulates production of thiamine oxidase. And there's also one of the vitamin Bs, if I'm not mistaken, I think it's vitamin B6, that also stimulates the production of thiamine oxidase. Okay, so would it be helpful? What would be the dose that we should give for those conditions? Again, because there's no evidence outside, look, just take what is the recommended daily allowance of those. Don't take too much, because too much vitamins also can cause problems, as you know.
Okay, that's very cool. Is anyone online who may have histamine intolerance or who is suspecting it? Please give us a shout. And if you have any questions, please let us know, because that's really how we can get this conversation flowing from your questions.
Yeah, it is, because, as I said, sometimes it's so hard to know a little bit more about that, and especially, and that's one of the things that I will say it again, as I said in the beginning, have allergy tests done when you suspect certain foods. Because sometimes the way that an allergic reaction might be manifesting itself is by having signs of histamine intolerance.
Right.
So they can, is because an allergic reaction can present in a different way. So that is one of the things on the guidance that is there to do, is that one. So look in that one. Let me just, I already have a bit of information on my side. Yeah. So that's exactly what I was talking about. It's I'll send you this one, the protocol. It's a very short one, but I love flowcharts, because flowcharts sometimes are so easy for people to understand. What shall we do?
Exactly.
And I can post this flowchart there, but it is exactly, I'm just looking at that one there. It is exactly what I said, because they also say about exposure to the drugs that either liberate histamine or inhibit DAO. So there's so many things, and that is why I find sometimes a bit frustrating when everything is put into a very small and same boat, when it is something a bit more complex than that. And sometimes small interventions can make the difference.
Yes, yes. And obviously, if people are suspecting anything, they can come to you. You can do the allergy test. You can even test for the DAO enzyme, right?
Yeah.
So all of
Yeah, it takes it's done. It's done. The lab that I use is probably currently is probably considered. So there are two very good labs in the country when it comes to immunology. One of them is a private lab, and the other one is an NHS lab. The NHS lab is Sheffield.
okay.
So the Sheffield NHS lab is absolutely amazing. They are really, really, really good. And then you have one in London. It's so good that a lot of the NHS trusts in London go to them to have tests being done,
Right.
called TDL. TDL is amazing as well, and that's the one that I use, TDL in London. They do all that. They run all those tests for me. Actually, they already know me. They have my contacts, and sometimes they are emailing me about some of the tests that I run, because I'm one of the few that requests them.
You're
But
one of
it,
the
it
few
is.
that sees MCAS patients as well, aren't you?
I am, unfortunately. Unfortunately, I am.
Okay.
There should be more people seeing MCAS, because I think that the true incidence of MCAS is far higher than what it is being reported. But
Right.
because there's not a lot of investigation into that one, there's no epidemiological studies, so we don't know when does it show, what age does it start, what we know the symptoms in general, but we don't know much more than that. So
Yeah.
I've been working with an organization called MCAS.org, so a UK-based organization, and I always tell all my patients that have MCAS to contact them to see if they are willing to release their details, because we are trying to collate all the data that we have to have a better idea for us to proceed into a bigger research project to get more data into this one.
Lovely. No, I think it's lovely that you see the MCAS patients.
It is. Sometimes it gives you too much of a headache, I can tell you that.
Oh yeah, I bet you have lots of them. I wanted to ask. So, if someone is on a lot of antihistamines, so they have histamine intolerance, they're on a lot of antihistamines, and they're managing the symptoms okay. When do you think it's time to sort of reduce the dose of antihistamine so one can challenge the food to see if there is an association? You see what I'm saying? Because
Yeah,
the antihistamine will mask their symptoms.
yeah. So I prefer to do things by steps. So there's two ways of seeing it. The first way is keep the antihistamines, give the food.
Okay, okay.
Okay, because this is the way. Sometimes it's more as confidence to the person, knowing that I'm taking my antihistamines, the symptoms are going to be under control. So
Mm-hmm.
when we give the food and we grade it, we start increasing it slowly, gently, sometimes over a few days, a couple of weeks or so. That is one of the ways to do it. The other one is, okay, let's reduce the histamines, see if there's any symptoms with your normal diet, and then if no symptoms are present or are showing up, then we try to give them the food. Um, the problem is, if they're going to start to have symptoms after the antihistamines are taken, then you need to start taking them straight away afterwards.
Okay.
Okay, and that is the big problem there, and we need to be careful with that. So, for me, I think that leave the start giving the food, and then we can work on that one.
Okay. Yeah. But this is actually for a patient. Well, I'm thinking to increase what I think is the trigger, increase that even more, and then
Yeah,
see if that's causing any problems before.
because again, as we don't know what is the best way around,
Yeah.
so sometimes people will deal things or make their practice, their plan according to their experience. And my experience is this one. Honestly, I don't know if it is the best one, but because there's no proper guidance on that,
Yeah.
I deal with it the way that I've been dealing with it.
Okay.
And as soon as I start having better results in one way or another, like many other people, I'll stick to it.
Yes. Yes. And
Is there evidence behind it? No.
yeah. Yeah. Okay, no, that's so helpful. I think this video will be so helpful for personally for me to send to people with histamine or where they query whether they have histamine intolerance. You
Oh,
know, having information like this is so valuable because I checked on YouTube and there are lots of bloggers that talk about it, but not many doctors. So I think this is very valuable.
the problem, I've seen a few, and I always take a lot of that with a pinch of salt. Because one thing is a blogger that goes there and talks about their own experience. Fair enough, it's good to raise awareness about that. But then the problem is when everyone starts to match their symptoms to that person, or that person, which happens well, unfortunately, start to saying that these kind of symptoms that I have are the symptoms of this disease. It's wrong. Absolutely wrong.
Yes.
Because I keep on saying everyone is different. And because everyone is different, everyone will have different symptoms. Everyone will present themselves in a different way. Everyone will need a slightly different treatment. Uh, for my patients with spontaneous urticaria and angioedema, with MCAS and all that, there is not one single one with the same treatment. Not one.
That,
Not one. All of them, the combination is so great, it's incredible. None of them have exactly the same treatment. I need to tailor the treatment according to the response that they have to that medication. Because some of them work better with some medications than others. And I don't know. There's no way for me to suddenly, yeah, that's it. I don't know. I have to trial. And I tell them straight away, when they come to me, I say, look, there's only one way, is trial and error until I get there. Are you happy with that or not? If they are happy with it, I'll start. If they're not happy with it, then sorry, I can't help. Because it's the only way to go forward. And the other thing that I also tell them is, are you ready to accept that probably the diagnosis is not this and it's something else?
right.
Because it's one of the things that I like to question often myself, if the diagnosis is correct or not.
That's wonderful. Wonderful.
Is the thinking outside of the box.
Yes, we need more of that in healthcare. Can I just ask? I mean, there are no. So anyone with any other allergy-related questions, this is your time to ask Dr. Costa. But I just have another histamine question.
Yeah.
Um,
Shoot.
so, what's the youngest you've seen with histamine intolerance? Can
Oh,
babies have it, like infants? Can they?
no,
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 okay. Because
no.
I've had a few patients in the past where parents, children, the child had calcium protein allergy, turned out to have other allergies, and then parents or mom was breastfeeding, and then they would query whether it was also histamine because things weren't improving. But then, perception of what is a proper poo is
Yeah.
different from person to person. So, but yeah, I've heard that histamine. I mean, a lot of breastfeeding mothers also try and go low histamine to try and manage their child's symptoms. So, yeah, I don't know what you think of that.
No. Let's go back to basics.
Yeah.
Histamine half-life 15 minutes. How come going on a low histamine diet will have any impact on the child?
That is just, you know what, I will remember that. Histamine has a half-life of 15 minutes, which means it's going to be in and it's out. So if someone has had that reaction, obviously it's there and then it's gone quick.
Yeah.
Well, okay. So that means when you look back at their food diary,
Mm-hmm.
it's literally the food they just had that
Yeah.
caused that reaction. Right.
So then you need to think of is if the mother doesn't have an antihistamine, so diamine oxidase or HNMT problem, then how is it going to affect the child?
Okay, okay.
They will process and degrade all the histamine. They can have a bunch of histamine food, but if they produce, because we produce enough thiamine oxidase needed for our histamine intake. Okay, that's how our immune system works. You take what it's like. Let's do a rough comparison. You have a lot of sugar, you produce insulin enough to degrade that sugar. Okay,
Yes.
the same principle applies for you take whatever amount of histamine, you will produce enough thiamine oxidase to counteract the histamine that you're taking. Is as simple as that. So if those mothers have no problems with histamine themselves, then there's not going to be any effect by breastfeeding by transferring that into the baby.
Okay, okay.
As I said,
Video from just
that's
send
how I say. Sometimes we need to go back to basics.
yes.
When we start, it's the problem about the human brain. We start to complicate
Yes.
everything. It's all instead of going back to basics and think what it is. And that is why this is part of something that I always loved in medical school, and I still have the books that I go and read, is about physiology. And if people understand physiology, they know how things work and how they can be connected or not. Okay? This is basic physiology. And when we understand the basics of physiology, a lot of what happens in our daily lives, we're going to understand. Daily lives, I'm talking about the illnesses, of course. We will understand. It's basic physiology. And if we think about simple things, as I said, most people don't know that histamine takes 15 minutes and degrades.
That is super interesting. Super interesting. I have many questions regarding histamine intolerance. So I know that the lots of women in menopause, going through menopause, report that a low histamine diet helps them. Is there evidence to support that?
Okay. Remember when I talked about hormonal imbalance?
Yes.
So, and when I spoke about puberty?
Yes. So
the other one is menopause, hormonal imbalance.
Okay.
Symptoms very much linked or look alike histamine intolerance. I have a few patients like that as well.
Okay, so it does make sense then to
Yeah.
not follow, because we're not promoting a low histamine diet, but it's looking at the high histamine foods and seeing whether some of them potentially trigger symptoms.
Yeah, because I had one of my patients that is perimenopausal that started having those symptoms, and she was advised to go on a low histamine diet.
What
So
symptoms
she did.
have, Dr. Costa? Sorry, what
Sorry?
symptoms have?
The ones associated with the histamine intolerance, hives and a bit of swellings here, and sometimes being itchy, and sometimes bowels affected.
Okay.
So one of the things that I realized, and when I spoke to her, and she said that she had gone into the low histamine diet, and I asked her, so did it work? And said, actually, it did at start, and then it stopped. I said, okay, so what do you think it is then? And she doesn't know the answer. And I said, well, probably you might have stopped eating some things that might have triggered some of your sensations, while others, for one reason or another, you didn't. But this is multifactorial. So you could have had the low histamine diet also on a day that you're feeling unwell because you had a viral illness or something else or didn't sleep very well. And because of that, you already are in a stress-related condition, and the low histamine diet might have helped you. Because we know that when we are in something that causes us stress, again, we go back to stress, something that causes us stress, our immune system doesn't react appropriately. It tends to overreact. So was it in a day like that or not? I don't know. Because most people, again, until I tell them, would you mind doing a food and symptom diary? They will not understand if there was something happening on that day or not. Because until then, they will focus mainly on one or two aspects that they think are the most important ones. And all the other ones are not important for them, which sometimes actually are the most important for me, because those are the ones that are leading to the problems. But until they do this, and then they send me the diaries and said, oh, actually, have you seen this one and that one and that one? And they say, oh, I never realized that. And yes, yeah, those ones are probably the ones that are leading to this. So again, is the case by case. So perimenopausal, yes,
Okay.
that can lead that.
Okay.
Uh, Fortunately or unfortunately, I haven't had any men on the
Okay, yeah.
perimenopausal, andropausal type of stage. I haven't had any.
So it's just the women.
So
Oh.
I cannot make comments on that. Please don't ask.
So last 5 minutes for any allergy related question for Dr. Costa. And then I think we have, we can round up histamine intolerance.
Oh, and if I can say something also for
Yeah.
those that because I have we have quite a lot of viewers often from London. So a bit of hot from the press. I'm soon going to start working, opening a clinic in Wimbledon.
Brilliant.
So if people from London would like to go there, by all means, I'm there.
That's
It's probably
wonderful.
going to be towards the middle of March. I'm going to start working in Wimbledon
And how often will you be there?
once a week.
Once a week.
Yeah,
Wonderful. I think that's very precious information for viewers.
because as you know, the rest of my time is dedicated to me and my son.
Yes, of course. That's lovely. You have a lovely work-life balance, Dr. Costa. We can
I
learn.
I try as best as I can. Sometimes it doesn't work.
That's brilliant. Brilliant. Well, thank you so much. This was so
You're
helpful.
very welcome,
Rest
Nishti.
of the week, we're sharing everything. We didn't talk much about food today because we're going to be talking about food for the rest of the week.
So
Exactly.
another time we can talk about mindfulness
Mind.
uh, and how it affects allergies because it does.
Wow, and then we could do. I could lead a mindfulness practice if anyone's keen on that. Give us some likes.
Yeah, absolutely,
So much
absolutely.
time on this Monday evening. It's very, very precious. I just think it's lovely that you give your time. So
No
thank
worries. Yeah, always a pleasure, Nishti. Always a
thank
pleasure.
you so much. Take care everyone
Okay,
for
okay.
joining.
I'll see you soon.
Bye.
Bye bye.
Bye. How do I end it?